You recording?
Yeah, it's recording now.
All right. And hello. Okay, so we're gonna start. Okay. All right. One, two, three. Hi guys. My name is Rahima, and we decided to do our group presentation on Cushing syndrome. It was very interesting for us, and we wanted to just learn more about it and wanted to go ahead and talk about it. So for this presentation, the objectives we have five objectives. We want to recognize the signs and symptoms of Cushing syndrome. We want to identify who's at risk for Cushing syndrome and what they should do to get tested. We want to discuss the risk factors, the pathology, and trajectory of Cushing syndrome. Also, we want our audience to understand the effects of the Cushing syndrome and the psychological health of it. And also, we wanted to discuss the treatment options for Cushing syndrome and the options. So, what is Cushing's syndrome? So, Cushing syndrome is a condition that results from hypercortisolism. Cortisol is a hormone produced by the adrenal glands. Like in this photo here, we have a picture of the adrenal gland and the kidney. And Cushing syndrome is a rare disease, and it affects about 10 to 15 million people per year. All right. Some of the signs and symptoms of Cushing's syndrome has to do with the upper body obesity, within the arms, the buffalo hump, red round face. Some people may be having high blood sugars, high blood pressure. Some people may be going through early or late signs of vertigo, blurry vision, acne, female balding, water retention, menstrual irregularities, thin skin and bruising, purple striae, poor wound healing, hirsutism, severe depression, cognitive difficulties, emotional instabilities, and some people may be going through sleep disorders also.
All right. So I'm David. I'm going to be covering the risk factors and our audience. What puts you at risk for Cushing's is the tumors, such as on the pituitary and adrenal adenomas, and also long-term use of corticosteroids, and females are more at risk, and both females and males 20 to 50 years of age. And it's also difficult to diagnose as well. It mimics other illnesses and takes 1 to 2 years to get a diagnosis.
So the pathology and causes of Cushing. So the normal way cortisol is released from our bodies is in the brain. You have the hypothalamus and the anterior pituitary gland, and the anterior pituitary gland secretes the hormone ACTH, which tells the adrenal glands, which are located above the kidneys, to start making cortisol. So they work with negative feedback. Also, cortisol tells the anterior pituitary gland to stop making ACTH to regulate cortisol in our body. But with Cushing syndrome, you have excessive amount of cortisol in the body, and you can get that through exogenous ways like steroids, corticosteroids, through chronic use, increases the cortisol in our body. And patients taking chronic use of steroids are those with asthma, lupus, RA, or other inflammatory diseases. Another way is through the body tumors. You can get a pituitary adenoma, so that's just in the anterior pituitary gland. You can get a tumor that just secretes excessive amounts of ACTH, which tells the adrenal glands to make excessive amount of cortisol. You can also have an ectopic ACTH production, which ectopic ACTH is another organ is making ACTH, which would be the lungs or the pancreas are the most common sites, and that also just tells the adrenal glands to make a lot of cortisol. Or you can get an adrenal adenoma, and that's just the adrenal glands making excessive amounts of cortisol. So the trajectory for Cushing's, since it takes 1 to 2 years to diagnose, the symptoms are more pronounced. So that affects individuals psychologically, interpersonally. So they're really affected when making relationships or friendships. They try not to be as social as they once were. And professionally, they are unemployed due to their symptoms. Some morbidities include diabetes because they have difficulties regulating sugar in their body, enlargement of the pituitary tumor, hypertension, osteoporosis, kidney stones, infections, and muscle atrophy. And how we diagnose Cushing's, there's a couple different ways. So you can do a scan like an MRI or a CAT scan, and that will show where the tumor is on the body that's producing a bunch of ACTH or cortisol. You can do a late night salivary cortisol measurement test, so that you just put cotton in your mouth and put it in vials, and you can do it at home, and it tells you if you have excessive amount of cortisol. You can do a 24-hour urine-free cortisol test. So you just collect your urine, and if you have an increase in cortisol in your urine, then you have Cushing's. You can do a midnight plasma cortisol test. So you stay in the hospital for 48 hours because they want to reduce any stress in the first 24 hours. And if you have a lot of cortisol in your blood, then you have Cushing's. And then the other two, they give you medications. And if you still have high cortisol, then you have Cushing's.
So the treatment options are surgical removal, cortisol inhibiting drugs, and radiation therapy. And the goal of the treatment is to
You're still on mute.
Oh. Okay, I'll edit that out. Okay, so the treatment options are surgical removal, which is the primary and optimal treatment for Cushing syndrome caused by tumors. So for pituitary adenomas, ectopic ACTH syndrome, and adrenal tumors. There are also cortisol inhibiting drugs that are used to control the production of excess cortisol, which include ketoconazole, mitotane, aminoglutathione, and mediripone. And also, radiation therapy is also used if patients are not a candidate for surgery. And that can be an option to treat CS caused by pituitary adenoma and ectopic ACTH syndrome.
All right, so I'm going to talk about the psychological disorders who are associated with this disease. And the main ones that manifest are anxiety and depression and mania and panic disorder. And as was previously mentioned, cortisol is the main glucocorticoid that is responsible for the stress response in us. And this is our fight or flight hormone. And this is activated when we are exposed to a stressor, and this initiates rapid changes in the body through the stimulation of the sympathetic nervous system. Now, when cortisol is activated, excitability results, and this can lead to behavioral changes like alertness, arousal, attention, and vigilance. And these changes that we experience, they allow us to cope with the stressors. Now, in this particular disease, these behavioral changes are constantly initiated to the point of becoming a severe form of chronic stress due to the overproduction of excessive cortisol. And these psychological disorders are very prevalent in older females in particular. And also, these individuals with Cushing's also have a very low quality of life as well. They have a negative, illness perception, they have poor coping strategies and low self-esteem, and a long diagnostic delay.
And so for teaching purposes, we wrote our brochure in a 7th to 8th grade reading level and in bullet points for most people to easily read and understand. And the image we chose highlights the most common symptoms of CS. We also made sure to include the most important educational points for people with CS. So the community resources for people diagnosed with CS are Cushing's Support and Research Foundation, which includes educational topics for people with Cushing syndrome and also includes patient stories. There's Cushing's Disease News website, which includes updates on new experimental treatments for CS. And the Barrow Neurological Institute has a Cushing syndrome support group, which provides virtual meetings through Zoom for people to connect with Cushing syndrome. So support groups can provide a sense of belonging, education, and a safe space to hear and share experiences. And so for education, we would want to teach people with Cushing syndrome to wear a medical bracelet, avoid extreme temperatures, infections, and emotional situations, and also to adjust medicine with the stress level experienced. They should contact their healthcare provider when the patient cannot adjust their medication correctly or they have symptoms of weakness, fever, nausea, or vomiting.
Good job, everyone.